So let us take further the Nash Therapeutics study streak, and there are three remedies which Dr. Nash mentions after the last three remedies that we discussed. And these three remedies which we will discuss today form a kind of a group in exhibiting their symptoms. And if you read Nash, you will see that Dr. Nash has a ability to pick up remedies in groups rather than rather than individualized remedy study only. Because when we study as a group, we will learn more and we will be able to give better comparison and differentiation ideas about certain remedy or remedy groups rather than studying them alone. Eupatorium perfoliatum, Eupatorium purpureum, and capsicum are the three remedies that we'll take up today. Now, whenever a patient comes to you clinically, he will tell you that there is a kind of a severe body ache. I'm also having coryza, I'm also having headache, I'm also having hands and legs pain and back pain, and there is lot of cough, etc., etc. But again and again in his uh, case narration, the patient will emphasize on lot of body ache. With every line, he will tell me, do anything but take this body ache away. And he would probably even moan or mutter or kind of drag himself in telling the symptoms because the body ache is so intense. That is Eupatorium perfoliatum for you to recognize in your clinics. Bruised feeling as if broken all over the body, arnica, belly spur, pyrogen are the remedies, but Eupatorium perfoliatum is one of the top remedies. Whether during fever or after fever, if there is an exhibition of these symptoms, Eupatorium is the remedy to give. Soreness and aching in the arms, forearms, painful soreness and aching of arms, forearms, painful soreness is in the wrist, as if broken and dislocated. This is what Dr. Nash describes about Eupatorium perfoliatum. So you have to understand the intensity of the complaints from the narration of the patient, whether it is of mild intensity, moderate, or the maximum intensity. And you will be able to recognize this intensity after seeing scores and scores and scores of patients. It will not come immediately, it will not come sudden, it will not be something that is visible in one night or one day. But after you see lot of patients, lot of arnica, and out of that, one arnica patient will tell you that the body ache is immense, and he will emphasize on body ache all the time, again and again, in every sentence, every narration. That is where eupatorium comes into picture. Broken parts as if they seem to be not conjoined to his body, or they have a kind of a vague feeling where there is lot of dislocation, and also the calf will feel as if they have been beaten. Aching pains as if in the bones with moaning. Patient, probably if the patient is a child, there will be lot of moaning. We will confuse the case with pulsatilla, we will confuse the case with pyrogen. But if you feel that there is a combination of pyrogen, rustox, arsenic, pulsatilla, then eupatorium is the remedy. Whether the case has influenza as a diagnosis, intermittent fever, or bronchitis, Eupatorium perfoliatum suits if the aching and the bony pains are described out of proportion to the complaints existing in the patient. And Dr. Nash tells us that the name bone set was given to Eupatorium on account of severe aching, as if the bones were broken, or that occurred in an epidemic of intermittent fever where Eupatorium cured. It was not a nomenclature, but from the cure of epidemic of intermittent fever, Eupatorium was given the name bone set. The epidemic was itself called as break bone fever. There was intense pain in the bones. Now there are three important things what Dr. Nash says, and this is what we should learn from Dr. Nash. He gives us three things important for each remedy or a group of remedies, and he tells us to focus on only these things because this is the thing that the patient will tell in the clinic. First thing is about the time modality, 7 a.m. to 9 a.m. Intense aching in the bones before the chill, and vomiting of bile or vomiting per se between the chill and the heat. Now, how will you find the phase between chill and the heat? The patient would complain of chilliness, and there would be a vomiting, and after a few minutes or a few hours, the heat starts or the heat phase starts and persists for a long time. That is what Dr. Nash tells about the vomiting in between the fever phase. Now we have to differentiate this same with natramure, arsenic, and also phosphorus, which will have a similar kind of a vomiting in all the patients. So there is another facet of eupatorium, and that is in the cases of cough. We will often find that we are having patients landing in our clinics after taking lot of allopathic medications, and there is one symptom which is not cured even after lot of allopathic medication taken, and that is the cough or hoarseness or the vocal cord related issues. Because the disease has not got cured, it has transformed itself into something that is of a, you know, kind of a organ which is not actively involved in the participation of the previous disease manifestation. So Dr. Nash tells us that there is a kind of a hoarseness in all the patients of certain kind, and it will only be there in the morning. Causticum is the remedy and eupatorium is also the remedy. How will you differentiate? Causticum will have lot of burning and rawness, whereas eupatorium will have more of a chest related complaints, pain or soreness in the chest. He also tells about ranunculus bulbosus. Now, in a clinic setting, to differentiate these two, three remedies quickly, you need to have that acumen to understand how and where to differentiate. Sore hoarseness, patient will tell you that it's there in the morning. You ask quickly whether it's there throughout the day. Any time of the day you find more. No, when I wake up, the hoarseness is more. Okay. What do you feel in the throat? Anything, or in the chest? Anything? He will tell you no. Throat is completely clear, but I feel lot of weakness in the chest, or I feel lot of pain in the chest. That is where you have to differentiate between ranunculus and eupatorium, and causticum is out of the race. Ranunculus will have pinpoint pains, whereas eupatorium will have generalized pains. And eupatorium will have scanty sweat, which is the next line mentioned by Dr. Nash, where it is compared with bryonia. Bryonia will have lot of sweat, eupatorium will have little sweat. But in hoarseness, if ranunculus, eupatorium, or causticum fail to cure, sulfur is the remedy that we can think of complementing. Now, next remedy Dr. Nash talks about after Eupatorium perfoliatum is Eupatorium purpureum. Now, very similar remedy, but I remember very well a case from my own practice where there was this lady having severe burning in the urine, and she was literally chilly and shaking with rigors. I thought there would be some sort of a fever or some sort of a malarial miasm or malarial disease present. But she was just shaking, and she told that since 2 days there is lot of burning in the urine, and she was panicking like hell. Want something immediately right now here and it now itself. Otherwise, I would go crazy. A similar state to arsenic, cantharis, and lot of rigors. This is where Eupatorium purpureum comes into picture. Dr. Nash also gives something beautiful about Eupatorium purpureum, that is urinary troubles in women, severe chilliness and body ache. A lady who lived near a marsh or a swamp for 7 years never had any appearance of malarial symptoms where she was living. But when she came away from that place and also from the quinine treatment, she developed the fever, and she was given Eupatorium purpureum 200, and Dr. Nash found that it was cured. And lastly, Dr. Nash compares capsicum with Eupatorium perfoliatum and Eupatorium purpureum. It will be a very similar remedy in the clinic. Capsicum will also have the same chilliness with the person in the body, in the physical body, like Eupatorium, purpureum, and perfoliatum. But Eupatorium will have a lot of shaking, which I also described from one of the urinary tract infection cases, whereas capsicum will have general coldness of the body and there will be chill. Last but not the least, a small one-page remedy by Dr. Nash on capsicum. He has mentioned there is burning. It is good for dysentery. It is good for later stages of gonorrhea, urinary troubles. But how will you find it in clinics? Number one thing you will find is burning. Definitely. Number two, you will find it in cases where there is disease in one part but pain is manifesting in another part of the body. That it is as simple as this. This is also similar to Dioscorea. This is also similar to Phytolacca. And capsicum stands in line with Eupatorium group of remedies because of the chilliness and the coldness that is present. Dr. Nash describes a case of a very long standing, and patient would have severe pain in the head whenever he would cough. He would literally hold the hands, and it would become so bad later on the patient had to just lie in the bed because it hurt so much. With capsicum the patient improved. So all these things, and one more important thing, if your patient is not improving, Dr. Nash has already told you can use anti-miasmatic remedies, but he has also given non-anti-miasmatic remedies or the other bigger remedies. You can see in Thuja he has mentioned nitric acid, staph, cinnabaris. All these remedies can be given as an intercurrent. So also capsicum. Lack of reaction in fatty people. All those people who are obese, who cannot yield to the medicine, they will need capsicum. That's all from Homeo Setu right now from me, Dr. Alpesh Oza. Follow WhatsApp channel, Instagram, Threads, Facebook, YouTube, and Twitter to stay updated. And for lectures, visit www.homeosetu.com. And a future offering from us is going to be a mobile app with lot of repertories, materia medicas, and lot of study courses as well. So stay tuned and keep following.